Well, hello. It's Bruce Williams again, and it's Friday, and it's time for another Gross Path Challenge, and I've been missing these for the last several Fridays following my Achilles surgery. I'm back in the office on Friday mornings, so I think it's time to start recording some more of these Gross Path Challenges. This particular test and the before after it will come to us from the Descriptive Veterinary Pathology course of 2010, which was a great year for the Descriptive Pathology course, which was still being held by the AFIP. That year we took it to Virginia Beach, to Turin, Italy, and to Hyderabad, India, and had 3 courses that year. In the next 5 Gross Path Challenges, you will see images from all these great pathologists. Most of them come out of the Pathology Image Group International, which was in some of its formative days back then. And there were some great images that they were kind enough to let me adapt for the Descriptive Veterinary Pathology course. With that, let's go ahead and get our pens and our papers out. Make sure that you give yourself 60 to 90 seconds per question. Pause in between. And let's begin. Slide number 1 is tissue from a skunk. I would like for you to give me a morphologic diagnosis and a cause. Okay, time's up. A classic lesion in a classic species. This is hard pad disease, and if you know about distemper in dogs, you know all about it in mustelids. It affects mustelids even harder than it does dogs, and the morphologic diagnosis for this particular lesion is a diffuse severe hyperkeratotic pododermatitis. Usually starts on the nasal planum, the paw pads, and the chin. The cause is canine morbillivirus or canine distemper virus. If I'd asked you for another lesion that you might see in this animal, bronchopneumonia is a major cause of death. These animals often have marked Peyer's patch necrosis and enteritis as well. Okay, slide number 2. Well, that's a gruesome looking one. It's tissue from an ox. And let's get a morphologic diagnosis and a cause. Okay, morphologic diagnosis is multiple or numerous facial papillomas or fibropapillomas. Look how big some of these are. When they tend to approach the size of your fist in a ruminant, which could be an ox or a deer, you want to think about fibropapillomas. The difference between a true papilloma and a fibropapilloma is that the fibropapillomas have a thick fibrous core, whereas the papillomas are primarily just large fronds of virally infected epithelium. Cattle have 6 different types of papillomaviruses, and keeping them straight can be somewhat difficult, and this could be a number of different papillomaviruses. The one that would probably be at the top of my list will be bovine papillomavirus type 2, which can affect the skin anywhere on the animal's body and generally causes fibropapillomas. A bovine papillomavirus number 1 and number 2 both cause fibropapillomas. These are the ones that, if they get into horses, will cause sarcoids. And the only difference really is that bovine papillomavirus 1, like bovine papillomavirus 6, tends to affect the paragenital areas, the teats, and the udders. But certainly this could be bovine papillomavirus 1 or 2. A bovine papillomavirus 3 would probably be number 2 on my list because it can affect the skin anywhere, but that's 3, 4, and 6. The Xi papillomaviruses generally result in true papillomas, which are epithelial only. but this animal's pretty torn up by them. So I think I would go 2, 3, and then 1 and 6. 1 and 6 both do the paragenital and the teats and the others. But 2 and 3 can affect the skin anywhere, and the only difference is fibropapilloma versus papillomavirus. 4, definitely not going to go with 4. That's one I would rule out because that primarily affects the upper alimentary tract. And then 5 is another teat and udder one. So just about anyone but 4 probably I would have to give credit for. Okay, that one was a lot of thinking. Let's move on to slide number 3, and this is going to be very straightforward. All I want from you is, this is tissue from a dog. How about a good morphologic diagnosis? Okay, time's up. Very straightforward. Whenever you look at the brain, you want to look at the top surface, but in cases of suppurative meningitis, sometimes the pus, because of gravity flow, will accumulate around the base of the brain, and that's what's happening here. You can see that the vessels are markedly congested, and then there is a suppurative exudate, and this is a diffuse suppurative meningitis. Cause, I can't tell you. A whole lot of things potentially could do this. I would think about gram-negatives. I would think about strep canis, which could do this, and so I just want to keep it simple. Not all these questions have to be really tough. Okay, slide number 4 is tissue from a horse. I'd like a morphologic diagnosis and 2 clinical signs. Okay, hopefully you got that one figured out. We are looking at the hypothalamus. The brain has been removed, and there is this large pituitary gland. And when we talk about horses, almost all of pituitary tumors in the horse are tumors of the pars intermedia. So the morphologic diagnosis is pituitary adenoma of the pars intermedia. And 2 clinical signs. You have signs that result from the pressure that these tumors exert as they grow upwards into the hypothalamus. Some of those would be hirsutism, or very long hair, because the hypothalamus controls the cyclic shedding of hair, and they don't shed the hair. Hyperhidrosis would be one. Somnolence, when you're pressing on the base of the brain, that's another possibility. The other clinical signs may be the result of hormones that are liberated as a result of this particular tumors causing a variant of Cushing's disease. So somnolence can also be part of the hormonal, because endorphins are one of the liberated hormones here. Polydipsia and polyuria go along with hypercortisolism, and of course hyperglycemia. So if you gave me any of those, hirsutism, hyperhidrosis, polydipsia, polyuria, hyperglycemia, and somnolence, you got to give me 2 for full credit. And there's a lot of things to talk about, but we have other slides to look at. This is an absolutely fantastic slide by Santiago Diab, I think when he was at the California Animal Food Health System. And I'm going to ask you to name the condition and give me a pathogenesis. Alternatively, I'm going to turn this one around. I will ask you for a toxic agent that would do that. So you can choose this one to pick one or the other. You can go with morphologic diagnosis and pathogenesis, or for the same lesion, I'll take a toxic agent. Okay, time's up. Let's go toxic agents. That's a shorter answer. Well, probably isn't. But toxic agent, this particular lesion, there are large subendocardial hemorrhages, and you can certainly get agonal hemorrhages, but that's not much of a question, so I didn't go with that. There are a couple of toxic agents that will do this in a horse. And if you notice, if you're able to pick this heart up, you probably see it looks a little blanched right here, a little pale. If you picked it up, it would be very sort of boggy and soft and heavy. And this can be seen with a couple of different toxins in horses. One is oleander and another one is taxus. And oleander or oleandrin has a very similar mechanism of action to a number of different cardiotoxins. Digitalis would be one, Wabane would be another, and it's very similar to what we see with monensin or ionophore toxicity. And what all these compounds do is they change the concentration of sodium within the cells, essentially depolarizing the cellular membrane. They can bind directly to sodium, or they also inhibit sodium potassium ATPase. And what happens, you have an accumulation of sodium in the cell, which also brings in calcium. And the sodium in the cell is bad enough. The calcium is even worse because it causes massive and almost irreversible binding of actin and myosin myofilaments. And so that cell contracts and stays in this very severe contraction. The other thing that it will do is calcium within the cell are going to poison mitochondria. So you get very acute onset of ataxia, myofibrillation, tachyarrhythmias, and death. These animals are generally normal, and then they go down extremely quickly. Same thing happens with taxus or U. And this is one where the lesions, there's no chronic lesions of heart failure. You're looking for basically something in the stomach. You got to find that in the oleander leaves or the taxus leaves within the stomach, and maybe between the teeth, because the animal's probably eating it very recently. Okay, I also asked you for a morphologic diagnosis and a pathogenesis, and if you thought about that one, I named the condition. And what I'm looking for there is possibility of purpura hemorrhagica. And the pathogenesis is that the animal's been infected with staph equi or previously vaccinated with a vaccine, and about 3 weeks later will develop a type 3 hypersensitivity reaction with antigen antibodies complexes deposited in basement membranes in many areas, and you get a vasculitis, very easily seen on mucosal membranes. The animal may have dependent edema due to the outpouring of fluid, and you can see hemorrhages like this throughout the body. So either of those, I think, are pretty good answers for this particular question. Okay, let's go on to slide number 6. That last one was a tough one. I'm going to throw you a bit of a soft pitch here, and this is tissue from a chicken, and all I want from you is a morphologic diagnosis and a cause. Okay, time's up. We're looking at largely the non-feathered skin. We have these large crusty scabs. A morphologic diagnosis would be multifocal coalescing proliferative and necrotizing dermatitis, and the cause is avian pox virus. Very easy to look at this and say it's avian pox virus. Everybody's got pictures of avian pox virus in various species. It tends to be transmitted by biting insects, so it is usually restricted to the non-feathered areas. And the morphologic diagnosis for every pox is very similar. They always affect the skin the same way. They cause marked proliferation of the cells first, so you get these big nodules, and that's just more skin cells for the virus to infect. It makes a lot of evolutionary sense. And then in the center of these lesions, in the older part of the lesions, eventually those hypertrophic and hyperplastic cells are overcome by the cytopathic effects of the virus. They rupture, and then the center areas are necrotic, often giving them sort of an umbilicated appearance. You shouldn't have to think about the morphologic diagnosis for pox. If you go with proliferative and necrotizing dermatitis or whatever, you'll do just fine. Okay, here's a classic lesion. So slide number 7 is classic lesion, and this is tissue from a pig. How about a morphologic diagnosis and a cause? Okay, classic. This is a great picture. If you're looking for this in pigs, section the nose right through the first premolar. That's where you'll get the best lesions. This one's been fixed, but you can tell there's no turbinate bone. So morphologic diagnosis here is diffuse severe bilateral turbinate osteonecrosis and atrophy. And there's probably not as much osteonecrosis going on. They're pretty much gone. There's a lot. So, and I always throw those two in there. I think usually it's concomitant. And the cause, and you have to have both of these for the correct answer in pigs. And people do argue about this. And what I'm looking for is Pasteurella multocida and Bordetella bronchoseptica type D toxin. And those two go together to cause progressive atrophic rhinitis and the very severe lesions. Animals can be infected with Bordetella bronchoseptica only and get very mild lesions. Bordetella bronchoseptica type D toxin will cause mild lesions on its own. It is the concomitant infection with Pasteurella multocida that gives us these really good lesions. Almost every pig has Bordetella bronchoseptica, and not every pig has Pasteurella multocida. Pasteurella multocida also causes atrophic rhinitis in rabbits as well. So pigs are not the only species to get atrophic rhinitis. Okay, slide number 8 is an absolutely beautiful picture of a classic lesion in a rat. So this tissue from a rat, and I'd like the morphologic diagnosis, and I want you to name the condition. Okay, time is up. Naming the condition, hope you're looking at this. We're looking at the mesentery. This condition is known as periarteritis or panarteritis nodosa. It's classically seen in rats, but can be seen in a number of other species, including dogs, where it's been referred to as beagle pain syndrome. And I've seen lesions like this in just about every species. But the rats generally have the best lesions. They're often in the mesentery. There are certain types of rats, including the spontaneous hypertensive rats, which really get good lesions. And these particular lesions, you can tell these very tortuous arteries will blow out, and the animals can die of hemoperitoneum. The morphologic diagnosis is a little trickier, and this is one that you probably, if you're going to be facing some sort of certification exam, just want to memorize it, because this is not the kind of lesion that you'd want to be trying to figure out a good morphologic diagnosis, while you're taking your exam. And the one that I have used for many years, and it's always worked for me, is multifocal to coalescing or diffuse necrotizing and proliferative mesenteric arteritis. Now let's break that down. Necrotizing, because if you take a histologic lesion, you see the classic lesion, so-called of fibrinoid necrosis. Not a great name for a condition, but because of damage to the endothelium, you have liberation and exudation of brightly eosinophilic protein and fibrin into the wall of these vessels, and they're just a bright red. And that's the necrosis part. The proliferative is you have a couple things going on in the wall here. You have marked smooth muscle disarray and hyperplasia, concomitant fibrosis as the body tries to stabilize the wall of this vessel, and then around primarily in the adventitia, maybe the outer media, you're going to have lymphocytes and plasma cells and macrophages, part of some chronic inflammation. And I lump those all together into the proliferative form. So once again, multifocal coalescing, necrotizing, and proliferative mesenteric arteritis. I think it's always been accepted by the ACVP. So you can make it a lot more flowery than that if you want. But that one works. Slide number 9. A lot of classics in this test, and that's a good one because I'm a little out of practice, as many of you are, since it's been almost 2 months since I've done my last Gross Path Challenge. And all I want from you from this tissue from an ox is a morphologic diagnosis and a cause. Okay, we're back, and it's a lovely picture of Blackleg. The morphologic diagnosis that I prefer would be a focally extensive necrohemorrhagic rhabdomyositis. Rhabdomyositis meaning skeletal muscle. If you just said hemorrhagic myositis, no, you missed the boat on that, because this is really necrosis. Most of the time when you see hemorrhage, you're really looking at necrosis in just about every disease. There are very few diseases that are hemorrhagic only. So this one, you got to have necrosis. You don't see it very well if you added these little dots here. If you added with emphysema, I think that that's perfect too. That might even be a little better. So because this gas-producing Clostridium shovii, often results in emphysema and little gas bubbles. The tissues are going to be dry as opposed to the healthy, well-vascularized skeletal muscle around them. And if you were here in person, it would smell like butter, have a very strong buttery smell. Other muscles that might be affected would be the heart, and in very young animals you can see it in the tongue and the muscles of deglutition or swallowing. And essentially you have to have an ischemic environment. So there's probably been, maybe the animal has had a fall and a big bruise or an inoculation or something that will set up an ischemic environment, which allow the pre-positioned spores of Clostridium shovii to begin to proliferate. The body of the cow is not a sterile environment, and there are Clostridium throughout the muscles, there's Clostridium throughout the liver, just waiting for some ischemia, and then it takes off. So usually there's some sort of injury, some sort of trauma in these areas. In the heart, that's a tough one. People think, well, maybe it's a lot of stress, and catecholamine release will result in an environment that is beneficial for Clostridium shovii. But a great picture of Blackleg right here. And we only have one more for this particular Gross Path Challenge. Slide number 10 is tissue from a pig. I'd like a morphologic diagnosis and a cause. Okay, get a good look at this one. Classic lesion that has been seen in pigs. The morphologic diagnosis that I want is bilaterally symmetric. And whenever you use the term bilaterally symmetric, you're usually talking about a toxin or a nutritional problem. This is indeed a toxicity. This is bilaterally symmetric polioencephalomalacia of the spinal cord ventral horns. It's not doing anything in the dorsal horns. It is just hitting the ventral horns. It's a classic acute lesion in pigs that have gotten too much selenium in a pretty rapid fashion. Usually it's a feed miscalculation. There are plants that will accumulate selenium. That tends to give you more chronic lesions, which result in alopecia or rhinitis or hoof separation, because those selenium tend to incorporate themselves into keratin and cause problems associated with keratin. But when you get too much too quickly, these animals generally become paretic or quadriplegic because of the damage to the ventral horns. And the pathogenesis is unknown. It could be due to the fact that high levels of selenium may cause niacin deficiency. There are some people that believe it's that too much selenium will result in the generation of reactive oxygen species as well. But it's a classic paralytic syndrome usually seen in feeder pigs. Okay, well, that's it for today. It's good to be back doing the Gross Path Challenges. I hope that you missed it as much as I did, and it looks like I'll be back in the office on Friday so I can put these together, and I look forward to putting together a bunch more of these Gross Path Challenges. I hope everybody has a fantastic weekend, and I'll see you next time.